Hi there, everyone. Welcome back to another Real Talk with Dr. Jim Sharps. Pleasure to have you back with us. Thank you for kind of your support on the channel as always. Very quick shout out. We're nearly at 1,000 subscribers. So if you are watching this video and you watch others and you find this of interest, please do consider becoming a subscriber and hitting the bell notification so you know when we do share a new video. It's usually on a weekly basis at the very least. But just so you're notified, we'd really appreciate that as we get to near 1,000 subscribers. So Dr. Jim, thank you for taking the time out of your day to be with us again. This week, we've had some input and some comments reach us in terms of suggested topics. And something that's come up is cannabis. So we really wanted to really start demystifying that and give the original medicine perspective. So Dr. Jim, if I may, in terms of discussing cannabis, is cannabis a good replacement for pain medication? I know sometimes there's a lot of conversations about it, but what's the original medicine perspective on cannabis being a replacement for kind of more prescribed pain medication?
Okay, good. I'm glad you qualified it by saying what's the original medicine perspective. And from an original medicine perspective, you want to use plant-based herbs that are known to have powerful physiological effects. And cannabis is an herb. It is a plant. It's plant-based. The CBD that they sell on the market for pain, the CBD oil, and some of the more pharmaceutical grade, they can be effective. They're not always effective. They're effective for some people. They've been known to be particularly effective for seizures and nausea and things of that nature. But from an original medicine perspective, it is worth trying. If there are so many things that work, that if a whole lot of other things aren't working, known natural anti-inflammatories, known painkillers like Jamaican dogwood, ginger, just a whole host of things. If they're not working, it might be worth trying. They're usually more expensive. There's a lot of marketing, and some people have gotten really good benefits from it, and for many, they don't. And like we always talk about, from an original medicine perspective, even good things, you have to look at individual requirements and capacities. So depending upon where you are, there are minerals, there are substances in there. And if you're missing those substances, then of course it's going to work. And can you get them in other foods and or herbs? Yes. There are cannabinoids. The good thing about CBD oil, and the reason from an original medicine perspective it might be worth trying, is because, in point of fact, the THC, the psychoactive effect, is not in the CBD. So that tetrahydrocannabinoids, they're not in there. So it removes the psychoactive effect, which is where a lot of people have a whole lot of problems, and they want to classify it, and it is an illegal drug in marijuana. So it's not marijuana. The THC is taken out. So yes, it can be, but I've had clients who've asked me that. They were using it, and basically I say, well, is it working for you? Or you can try it. And as I said, in some cases they see some help, but there are many things that are actually more powerful. I think it can be a very good part of a synergistic combination of pain relieving herbs. And as you know, when we talked about RBTI in the past, the way I look at it is, okay, well, let's see if subjectively or is it moving the numbers towards perfect. So we have a tool for evaluating that on a personal basis, but I'm not of the school of either saying that it is a cure-all, or on the other side that it's a dangerous drug. And so you need to take a balanced approach. And from an original medicine perspective approach, it could be a part of an integrated and comprehensive application of those laws of health.
Thank you for that, Dr. Jim. And just clarifying a point, we again, from my limited understanding, I think there's words that are used synonymously, and I think it would be good just to clarify. You've used the word CBD.
Mm-hmm.
We kind of started on cannabis. You mentioned marijuana. Does original medicine make distinctions between, are they the same, or are there kind of distinctions? You mentioned psychoactive parts. If we could just zoom in to make it super clear, unless we get clipped and it's like
Yes.
Dr. Jim says the original medicine is marijuana is good.
Oh, no.
Clarify that for us a little bit.
Yeah, the CBD, the ones that they're talking about that have the medicinal effects, are the ones that are sold, that can be sold over in the marketplace. It's the cannabinoids without the THC. The THC, it doesn't have the psychoactive part. Now, people actually get effects from marijuana. It has both, and it does relax the nerves and things of that nature. And some of this is political and economic. So there's the science, and then there's the politics, and then you look at it from a medical standpoint. Why do you want to have an herb that's relatively inexpensive that anybody can acquire? Then rather than these very, very expensive or prescription requiring analgesics. As a quick segue, if you don't mind, even fruits, vegetables, nuts, seeds, everything has poisons in it. All foods have some poisons in it, and it has to. If it didn't, then while it's growing, the animals will eat it all up before it matured. But when it's in the way it was designed in original medicine, those poisons in the food, it has other chemicals that balance it out and or are the antidotes for the poison. So if I tell you, for example, if you ask me, is arsenic good for your heart? Most people say no. Arsenic is the single highest mineral. The highest amount of arsenic in the body is found in the heart, but it's in a bioavailable form that you get in fruits and vegetables. In this particular case is asparagus. So if you eat a lot of asparagus, you're getting it. Now, if you took isolated arsenic and you took too much, it will kill you. If you took a very, very small amount, and that's where you get into all of, okay, what is the right amount, height, weight, size. So it's very important to understand that delicate balance. And in fruits and vegetables, and seeds, in the seeds, there are some things that in isolated form are toxic. And so if you take away a lot of the economics and politics, then the context of something like CBD, yes, it can be effective. It can fit because it is in its whole form. But if you isolate certain of those cannabinoids, those certain chemicals, they can be very, very dangerous and harmful. So in its whole form, and that's the other thing that raised the question, the product that you're using, you have to look at the sourcing and the processing integrity. So it's not one of those things that you can just answer right off the cuff. So even herbs, if you can have the best herbs, if the sourcing is bad and the processing is compromised, then it's not going to be as effective. But original medicine, fundamentally, from a healing standpoint, when you're talking about healing herbs, they are put together in a way that's balanced for human consumption. And that's what the original medicine approach basically is. It's looking for the best plant-based approach. And there are times when the pharmaceutical approach is the recommended approach for the short time, especially for acute issues. So if I got my leg cut off and I needed to have an analgesic, I'm not going to be looking for a whole bunch of herbs. You want an anesthetic, but you don't use that anesthetic every day. You use it to get over that acute phase, and then you get off of it as quickly as possible as you transition to an original medicine approach. So sometimes original medicine is complementary in an acute case, but in most cases, when I say most, I'm talking about over 90% of the cases, original medicine is far superior in terms of reversing and or actually preventing and or reversing most of the things that we go to doctors for, over 90%. Does that help at all and give me some context?
Very clear.
For
I appreciate you clarifying that. So, I mean, just a final question then, since I think you've covered the main kind of pure points here on the topic. At a very practical level, if somebody is currently prescribed pain medication or an analgesic, as you kind of termed it, can that just be kind of switched with CBD? How would you, advise somebody who's kind of watching this video, listen to what you've said, has kind of prescription analgesic kind of medication? What would you say, how should they approach that in terms of switching to, the original CBD approach?
Medical doctors can try it. See, I have to be kind of careful the way I talk about this. If you're on a prescription drug, that's prescribed by a medical doctor. And original medicine, we don't prescribe. We don't treat symptoms. We treat causes and contributing factors. So you can suggest that person work with their their primary care physician and looking at it. And some medical doctors use it, and they're familiar with it. Most aren't. They're not taught about that in medical school. So you have to understand those realities. So I personally have worked with people, and as I said, I've seen mixed results. And I'm not an expert on it. Don't plan to be an expert on it. There's just so many things out there. But as I said, I'm not like some people, knee-jerk, absolutely it doesn't work for anything, or that is on the other side, it's a cure-all for everything. So you have to recognize that and put that in the proper context.
Dr. Jim, thank you for that. It's a topic that I'm sure is going to generate a lot of comments and a lot of discussion. So we're more than ready for it. So if you have comments or thoughts you want to share on this video, or even further questions, please don't hesitate to comment. We do monitor that and we do reply where we need to. But otherwise, we really appreciate you taking the time, Dr. Jim, to share with us on this topic, and look forward to maybe seeing your clips of your original medicine response floating around the internet. But we appreciate you shedding some light on the topic. And that's all for now, and we'll see you on the next one. Thank you for watching. We'll see you soon. Bye for now.
You're welcome. Bye for now. God bless.